Am I okay? Yeah, yeah. Yeah. Okay. Good afternoon, everyone. I'm Mayor Paulette Guajardo, and thank you for joining us this afternoon. We're hosting today's news briefing to update residents on COVID-19 and its variants. So the Omicron variant is spreading and it's growing in different countries, including the U.S. However, it has not been detected in Corpus Christi. We know that, but we also know it's a matter of time. So I guess I want everyone to remember or remind everyone how highly transmittable and severe that the current Delta variant has been compared to the original virus and other variants. Please remember that we have powerful tools such as vaccines, booster shots for ages 18 years and up, and testing to fight against the COVID-19 and its variants. We have had over 1,300 area residents that have lost their lives because of COVID-19, and as we all know, even one life lost is too many. I know all of our residents would like COVID-19 to be over, but the health experts still urge residents to be vigilant. The CDC and the World Health Organization continue to remind us to follow their guidelines, which include vaccinations, frequent testing, social distancing, and frequent hand washing as effective ways to combat the virus from spreading. Last year, many area schools and restaurants were closed. Other public places were limiting capacity, and residents stayed at home, which resulted in low flu cases. So now that the city and county is returning to some normalcy, doctors have noted that flu season has begun. The numbers are increasing in states surrounding Texas, but Texas does have a relatively lower rate at the time or at the moment. That, however, does not allow you to please don't let that to allow you to let your guard down. Both COVID-19 and flu cases could rise, and as more people are traveling, gathering during the holidays, it's more pertinent to do so. Hospitals are seeing a slow uptick in COVID-19 cases. Doctors also strongly encourage residents to please get a flu shot because some hospitals are still at high capacity. So anything that you can do to help keep yourself and your loved ones out of the hospitals right now is important, and always. Yesterday at our city council meeting, Dr. Ram stated that early indications are that the Omicron variant is more transmissible than Delta, and it is because of replication. Viruses replicate, and that's how they survive. They need a living source, such as an animal, a plant, or a human being to replicate. So as I stated before, the Omicron variant is not in Corpus Christi. However, there have been some reports that it might be more evasive from vaccines, according to experts. Dr. Fauci emphasizes that research is being done to answer three key questions. How transmissible is this variant? How severe is the variant to us? And most importantly, how effective are our vaccines against it? Many experts are recommending that residents ages 5 and up should get vaccinated and, if eligible, get a booster shot to fight against the COVID-19 variants. In addition, at the City Council's meeting yesterday, Health Director Annette Rodriguez talked about the multi-layer Improve Success Plan, or the Swiss cheese model. This means that the more layers of protection that you cover yourself with, the less likely you are to get infected or to infect others. So like a piece of Swiss cheese with all the holes in it. The more those pieces of cheese are layered, the less the penetration through. So as your mayor, I want to encourage everyone who wants to get that vaccine to please do so. In response to this new variant, I want to again remind the community that COVID-19 vaccines are readily available throughout the city, and our team stands ready to assist you. We need to work together as a community to ensure public health. We can help stop this pattern by increasing the vaccination rate in our community. So if you were vaccinated over 6 months ago, get your third dose or your booster dose. We can each do our part and follow CDC guidelines so that we can keep Corpus Christi safe. And lastly, though the Omicron variant has been detected in Texas, this is no time to panic. We know what works and what to do. Get fully vaccinated, get your booster, make good decisions, and let's keep Corpus Christi healthy. Thank you.
Variantes Delta y Omicron de COVID-19. La variante Omicron se está extendiendo en un número creciente de países, incluyendo los Estados Unidos. Aún no se ha detectado en Corpus Christi, pero debemos estar preparados. Contamos con vacunas originales y dosis de refuerzo para mayores de 18 años y pruebas para luchar contra el COVID-19 y sus variantes. Hemos tenido más de 1,300 residentes del área que han perdido la vida a causa de COVID. Los CDC y la Organización Mundial de la Salud, o OMS, continúan recordándonos que sigamos sus pautas que incluyen vacunas, pruebas frecuentes, distanciamiento social y lavado de manos frecuente, como formas efectivas de combatir la propagación del virus. Aumentan las temporadas de COVID y la gripe. El año pasado se cerraron muchas escuelas y restaurantes de la zona. Otros lugares públicos limitaban su capacidad y los residentes se quedaban en casa, lo que resultó en un bajo número de casos de gripe. Ahora que la ciudad y el condado están volviendo a la normalidad, los médicos han notado que la temporada de influenza ha comenzado. Tanto los casos de COVID-19 como de gripe podrían aumentar aquí a medida que más personas viajen y se reúnan durante las vacaciones, por lo que los médicos también recomiendan a los residentes que se vacunen contra la gripe. ¿Qué es Omicron? Los primeros indicios son que la variante Omicron es más transmisible que Delta y se debe a la replicación. Los virus se replican y así es como sobreviven. Necesitan una fuente viva, como un animal, una planta o un ser humano para replicar. Y aunque aún no se ha detectado en nuestra ciudad, han habido varios informes de que podría ser más evasivo a las vacunas. Los expertos tratan de responder a 3 preguntas clave. ¿Qué tan transmisible es esta variante? ¿Qué tan grave es? Y la más importante, ¿qué tan efectivas son nuestras vacunas? Los expertos continúan recomendando vacunarse para evitar contagios y sobre todo crear inmunidad. Las vacunas COVID-19 están disponibles en toda la ciudad y nuestro equipo está listo para ayudarlo. Necesitamos trabajar juntos como comunidad para garantizar la salud pública.
Good afternoon, everyone. Barbara Canales, Nueces County Judge. I'm really here to help bolster some of the comments that you've already heard and some of the remarks that you know are already important. But I do think that it's worth mentioning once more that just a week ago, that's how fast everything changes, we learned about this new variant of the coronavirus called Omicron. And we held a press conference in Nueces County Commissioner's Courtroom. And we said, hey, it's most likely going to be here in our country, in our state. And true to that prediction, it was detected the very next day in the United States. And so just over a week ago, we had 0 cases of the variant. And now, of course, Omicron variant has been detected in 50 countries, 19 states, including the state of Texas. So while the mayor is very accurate to say that it is not here yet, I can tell you that it's going to be here. I mean, that is something that we know. And while we have not had a genomic sequencing identify it, you need to prepare as if it was here, because we know that all the data and all the science tells us that most likely it is. And of course, much as has already been stated, we're still in the early stages. And when we're in early stages, there's too many unknowns, particularly about this new variant, including the severity of the illness it produces. I'm always, anxious to find that one piece of good news, and I try to hold on to it. And I like this good news that it doesn't look as severe. It looks highly transmissible, but in the small populations that they've got some good data, like in South Africa, where it first began, first detected, it doesn't look as severe. But we need to be thoughtful and cautious and wait, because it could affect different age groups differently. It could affect our vulnerable populations differently. Our health conditions, particularly, seem to be very vulnerable to infection. And exactly how effective the current vaccines are at preventing infection, we're going to find out more. Preliminary news reports this morning shows that Pfizer has some good efficacy on the Omicron variant. That's also very uplifting news. What we do know is that wherever it appears, Omicron displaces the Delta variant as the predominant strain, even faster than Delta replaced the original coronavirus. So you know how the whole country was Delta? Well, it appears that within time, it's going to be that Omicron will replace Delta. And we know that current vaccines definitely provide some protection against the Omicron variant. Now, how much? Well, it's too new. The variant's too new. And so the data is being compiled. But what we do know is enough to say that vaccines are still the best protection we have, period. It's the best protection against infection, hospitalization, and death. And remember, even if you get really mild symptoms, this could affect getting, your work. It could affect your workforce if you're a small business. It's going to affect your potential ability to go to work and create a continuity of operation. So let's avoid Omicron altogether and get that protection that we know is valued. Now, this is one of those cases where, as they say, waiting for the perfect data is really just a bad idea. I love data. I say it all the time. Data drives decisions. I look for data. I fight for funds to get data. That's wonderful. It's wonderful. But in this particular situation, waiting for some result to come out and not getting protected is a bad idea. It is better to be roughly right than precisely wrong. And I think that's my message here today. It's better to be roughly right than precisely wrong. And being roughly right, to me, means getting vaccinated. Because if you're not yet vaccinated, you're going to be most susceptible to the transmissibility of this highly contagious virus. So, certainly, if you've already been fully vaccinated, being roughly right also means get your booster. And I think that that's also an important conversation, and you're going to hear more about all the great locations that we have. And also, for getting back into my roughly right means paying attention. Paying attention to all those personal health habits that we've learned over the last 2 years to make part of our muscle memory. If you do those things and you've done the best you can with the information that you have, well, I always say that you should emulate best practices. And you're about to hear from Health Director Rodriguez, so I'm going to go ahead and steal her line. But she always ends with stay healthy, stay safe, and stay informed. And so I want to tell everybody that these are the days ahead, even if we're in the holidays. We're going to be surrounded by people who love us and whom we love. So this is the exact time it's most important to stay informed because it's fast moving. Remember what I said a week ago, we basically are predicting that it could come to our country. And now it's all over our country. So this is a fast moving virus. And because it's fast moving, we're learning every single day new information, which I believe these public messaging COVID-19 press briefings are very important to keep up. And so pay close attention to your health. If you're not feeling well, remember, go get that COVID test as soon as possible. Don't wait. We've got good treatments, and you're going to hear about some exciting news that Director Rodriguez just shared with me about monoclonal antibody treatments for certain groups. So again, if you do feel ill, please get tested because there are ways that we can get effective treatments. And remember, these treatments, they work best only in those early stages of COVID-19. If in doubt, get checked out. And Director Rodriguez and Dr. Bird, I see, is here today, and they're going to have great information for you. And so I will direct your attention to them at this time. And again, my goal, I just delivered State of the County, and while I was incredibly verbose about all the great things that I think that we've accomplished, I think I spent the most time and I was most passionate and emotional about that subject which means the most to me, and that's the public health of our community. Because without that, we have nothing. There is no happiness without health, and there is no wealth without our health. And so please make certain that you stay in tune with accurate information that we give to you here or on our websites, noisesknows.com, cctexas.com, or our public health district. And as soon as we know it, or if something changes, count on us. We're going to bring you this up-to-date info. But here's my favorite line. We do know what we do know. And that is that vaccines work. So it's very simple. My holiday message, the card I want everyone to receive this season, is your vaccination card. So get vaccinated, get boosted, and again, when I see something that works, when I'm impressed by the perfect words, they bear repeating. So stay healthy, stay safe, and stay informed. Thank you.
Hace poco más de una semana se dio a conocer la nueva variante Omicron y también su presencia en los Estados Unidos. El día de ayer ya se había detectado en 50 países y en 19 estados en los Estados Unidos, incluyendo Texas. Poco se sabe sobre esta variante, incluyendo la severidad que puede producir a una persona enferma. Lo que sí sabemos es que en donde se ha presentado, ha reemplazado a la variante Delta como variante predominante. Sabemos que la vacuna continúa proveyendo de protección, por lo que le pedimos vacunarse si aún no lo ha hecho. Las vacunas son la mejor opción para poder evitar así las hospitalizaciones y sobre todo la muerte. También que continúe tomando todas sus precauciones. Le urjo a todas las personas continúen informados, ya que esta variante se mueve rápidamente. Esta es la mejor época de estar informados, ya que habrán reuniones con familiares en pocos días. Cuide de su salud, monitoree su salud y si se siente enfermo, tome la prueba y los tratamientos que están disponibles. Durante mi discurso del día de hoy sobre el estado del condado, di información sobre la importancia de lo que es la salud pública para todos los residentes.
Thank you, Gabby. Annette Rodriguez, Health Director. So I am going to give you some updated statistics, but I wanted to start with a chart that y'all have probably not seen. First chart, please. So this one basically shows the different waves that we've had here in Nueces County. And you're going to see the spike all the way to your far left. And that spike shows 10,000 people with COVID-19 in July of 2020. That was our first wave. And then if you look at November, December, and January, you're going to see what we call the second wave. And then if you look at this past August and September, you see those high numbers here. That was almost 12,000 cases in Nueces County in that 1 month of August. That was our third wave. And so what we're looking at right now at the health department is we're looking at the fourth wave coming, and we know that Omicron is on its way. So for the next slide, I want y'all to pay close attention to the August, September, October, November graph that we just saw. We're just going to open that up. So there's August 15th through December the 5th. And what you see is you see a trend line that looks like it's coming down nicely. So, but if you look at this last week, November 29th, right after Thanksgiving to December the 5th, you kind of see that it looks like it might be going up. That may be the beginning of our fourth wave right there. So 286 the week before, 299 the week before that, 420 the week after Thanksgiving. That's the one that's concerning to us. What we can tell you is that those are still Delta, as far as we know. We've only genosequenced Delta at this time. Next slide. The total number of vaccines administered by the health district, there's been a lot of other vaccines that have been given by other providers in our community and hospitals. Thank you all for that. But for the health district, those that we've administered with the help of the county has been almost 183,000 vaccines. And so you can see here how many people have gotten Johnson & Johnson, 8,800. How many people have gotten Moderna vaccines? That's 134,953. How many people have gotten Pfizer, what we call the adult dose? That's 36,000, but that actually includes 12-year-olds and older because they get the adult dose. And then how many people have gotten Pfizer with the pediatric dose? That's the 5-year-olds to the 11-year-olds. That's 2,204. So there's always room for more people to get vaccines, but these are the numbers as they currently stand. Next slide. How many boosters have been administered by the health department? Only 14,471. So we still have a long ways to go because we almost have 183,000 people that have been vaccinated. So 14,471. So we still have a lot of individuals that can get boosted now. I want to remind individuals that need boosters, it's only for those 18 years and older. Only for adults is currently approved at this time. Pfizer is trying to get approval for the 16 and 17-year-olds to get boosters, but that has not been approved. So if you're a 14-year-old, a 15-year-old, a 13-year-old, you cannot get a booster. 18 years and older, and it's 6 months after your second mRNA or 2 months after your one J&J. Next slide. What are the vaccination rates for Nueces County? So the vaccinations are 53% for the entire population, and that is how statistics are done, except if you look at a lot of numbers in different parts of the United States, you'll see that what they do is they say of the eligible population. So if you look at for those ages 5 and older, that's almost 57% that are fully vaccinated in Nueces County. And if you look at for those age 12 and older, that's 63%, and then ages 65 and older, it's almost 80% that are fully vaccinated. Recalling that we started with the older population, so it makes sense that most of those individuals are fully vaccinated. But we also need to work on the other categories, because 53% of our population fully vaccinated means that there's about 50% of our population that's not vaccinated. Next slide. So the Omicron, the B.1.1.529, which is a variant of concern. And so the WHO calls variants of concern, and that's because their scientists look at it and they say, there's something here that could cause a potential threat to everyone. And so that's why they name it a variant of concern. There was only 4 previous variants of concern before Omicron. There were the Alpha, there were the Beta, there were the Delta, the Gamma, and now the Omicron. So the timeline is November 11th, the first known confirmed infection discovered in Botswana. And then November 26th, we actually, that closely, a few weeks later, we had the U.S. restricted travel from South Africa countries. And then December 1st, we had our first U.S. case confirmed in California. And 5 days later, that's what's really important, because normally when we see flu, we see it up north, and then it takes a long time, a couple of weeks, months before it comes down south. But in 5 days, we saw the first confirmed case of Omicron in Texas, and that was in Harris County. And since then, we've seen at least 16 additional states that have reported Omicron cases. And so again, like the judge mentioned, like the mayor mentioned, it is highly transmissible and it's spreading quickly. Next slide. The other things, when you look at variants of concern, you look at least 3 things. You look at more than that, but at least 3 things. One of them is how contagious is this variant? The other is the ability to escape immunity. And that's either because you've been vaccinated and you have immunity, or because you've had COVID-19 in the past and you have immunity. So does this variant cause you to still get sick even though you've had both of those, or either one of those? And then the last is the pathogenicity of the variant. How severe is this variant going to be? The health district has sent out 7 samples that we've already received results from, and they were all Delta. That's the good news. And we've sent out an additional 5 samples to the Department of State Health Services for sequencing, so we're hoping to get those results soon. And again, as soon as we have a case of Omicron, we will definitely let you know. So what are the characteristics of Omicron? Okay, so it has a large number of mutations on the spike protein. Everybody's heard that. The mutations are similar to previous variants of concern, like the Delta, and that's the transmissibility part of it. The variant may escape immunity, that I've already mentioned, and it may also increase the risk of reinfection. So you've already had COVID-19, you maybe had the original COVID-19, and now you're getting COVID again, but now you're actually getting the variant Omicron. And the last is that it may be difficult to estimate the virulence because, again, this is actually so new, this Omicron variant. For vaccine breakthrough cases, and again, we've talked about that these vaccines may not work at the same level that they were working for the Delta. We have seen here in Nueces County 1,740 cases that people were fully vaccinated, and then they still came down with COVID-19. The number of hospitalizations from those 1,740 cases was 196 people that had to be hospitalized, and of those, 69 people ended up dying from COVID-19. So what do we do? Well, for sure, we don't panic. So when there's a hurricane coming, we don't all, run for the hills. We prepare. So we go and we buy boards, we go get water, we go make sure we have stock up for food, we make sure we have batteries, everything that we need in preparation for a hurricane. The same is true for Omicron. We know the variant is coming. We don't have to wait for the piece of paper to verify that it's coming. So what do? We can get vaccinated. We can get our booster, and I think Pfizer just came out yesterday basically saying that they know that that their Pfizer vaccine does not hold up as well until you get the booster. So make sure that you're getting your booster if you're eligible. So your boosters, you can get them 6 months after your second mRNA or 2 months after your J&J. Children ages 5 and up should also get vaccinated. Again, there is no boosters for children. And the public health measures should be followed, which means wearing your mask, especially in congregate settings, keeping your home and workspace ventilated if you have company, if you're having parties, if you're in a congregate setting. Stay home if you're sick. And this is really important for employers, is to make sure to enforce that. A lot of people like to think, well, it's just allergies, I really need to work, and then the whole business is infected with COVID-19. So please, if they're sick, send them for testing. Let's make sure that they don't have Omicron, and don't let them work until they're cleared of that. So also washing your hands often, because you do not want to infect yourself with dirty hands, touching your eyes, nose, or mouth. And so the multi-layer Swiss cheese pandemic defense, as the mayor was mentioning, it's kind of what they depict as the Swiss cheese. So you see there's holes in the Swiss cheese. Well, there's holes in all of our precautions as well if you just use one. So you try to make sure that you use as many of them as possible to keep yourself as safe as possible. Because when you stack up that cheese, you can't see anything through it. Those holes, they'll end up covering themselves. So make sure that you're layering these on, because people say, what do? I really don't know what to do in it. I feel like I've done everything. There's always more you can do. You can stay away from congregate settings. You can limit the amount of time that you're in a congregate setting. Again, remembering if you need to go into the grocery store, what do I need? I need 4 items. I go get those 4 items, and then I come out. I don't just browse around. So there's a lot of things that you can do to protect yourself, but vaccines are definitely the best defense at this time, and so we encourage you to get vaccinated. If that is not something that you're wanting to do, that's completely up to you. So what's coming up in the future? So for the future, we have monoclonals. Antibodies are also now approved for a younger population. This population are the pediatric, including newborns, which is really good, because before we were just doing 12 years and older. You had to be at least 88 pounds. So now they're even giving the monoclonal antibodies to the newborns. Also, the FDA advisory panel recommended the Merck's COVID pill. So we still have to see if it gets approved by FDA, but this is a pill. This is actually an oral drug, for treatment. So that's exciting as well. And so we're anxious for that to come out. And then Pfizer studies are being conducted currently, and they're in their second and third trials right now, clinical trials for those that are 6 months to 2 years old, and those that are 2 years to 5-year-olds. So as soon as those are concluded, we hope to get the good news that yes, those populations can get vaccinated as well, but until then, they're not eligible at this time. And then something, and the judge was mentioning, that just came in about 30 minutes before I got here, and it basically says that there's a new monoclonal antibody that's been approved by the FDA, and it's for pre-exposure prevention of COVID-19 in certain individuals. So this isn't a post-exposure. This isn't I got sick and now I need something. This is a pre-exposure prevention of monoclonals. But this is only for two particular groups of people. And that's for those individuals that are moderate to severely compromised immune system due to medical conditions or due to their taking immunosuppressive medication or treatments, and they may not get enough of an immune response with the COVID-19 vaccine. They can get this monoclonals. And it's from AstraZeneca, and it's called Evusheld. And the other group is if you have a history of a severe adverse reaction to the COVID-19 vaccine or any of the components of the vaccine, and you know I can't take the vaccine, you could actually get this Evusheld from AstraZeneca. And these are monoclonals that were just approved today. And so we're very excited because we're trying to have as many tools in our toolbox to safeguard as many people as we go into the winter months. And that's all I have. Thank you all.
368 casos se han reportado en lo que va del mes de diciembre, 985 en noviembre, 1,665 en octubre. Los casos semanales van en aumento. La primera semana de noviembre se reportaron 309, mientras que la última semana de noviembre 420. La segunda semana de agosto fueron 3,576. Esa fue la semana con el mayor número de casos durante el verano. El total de vacunas administradas han sido 182,955, más de 134,000 de la vacuna Moderna. Las vacunas de refuerzo administradas han sido 14,471. Del total de la población del condado elegible para la vacuna, el 53,1% está completamente vacunado. La variante Omicron fue descubierta y reportada por primera ocasión el 11 de noviembre en Botswana. Al 6 de diciembre han sido 16 los estados en Estados Unidos que han reportado su presencia, incluyendo Texas. La preocupación de la variante es su nivel de contagio, su habilidad para evitar la inmunidad y la patogenidad de la variante. Esta variante tiene un gran número de mutaciones. Algunos modelos computarizados sugieren que la variante puede evadir la inmunidad. Las mutaciones también pueden incrementar el riesgo de reinfección. Un número pequeño de casos documentados hacen aún difícil la tarea de determinar su nivel de virulencia. Continúan reportándose casos extraordinarios de personas infectadas, aun y cuando fueron vacunadas. La mayoría de quienes recibieron la vacuna Johnson & Johnson, el 2,8% de todas las dosis administradas en el condado. 1,740 casos en total, 196 personas fueron hospitalizadas y 69 decesos. Se le pide no entrar en pánico, pero sí estar preparado. Vacúnese si no lo ha hecho. Tome su vacuna de refuerzo 6 meses después de su segunda dosis de las vacunas Moderna o Pfizer y 2 meses después de la vacuna Johnson & Johnson. Se toma hasta 2 semanas después de la vacuna para lograr una inmunidad. Hace unos minutos también llegó información de que existe un tratamiento monoclonal para prevención solamente para 2 grupos, para aquellas personas con condiciones médicas o para quienes quienes se encuentran tomando tratamientos. Este tratamiento es de la farmacéutica AstraZeneca. También puede ser para personas que no pueden tomar las vacunas.
Right, good evening, everybody. My name is Dr. Chris Bird. I'm here to speak to you on behalf of the Texas A&M University Corpus Christi Informatics and Modeling team. And this is the weekly pandemic report. We have 2 objectives. One is to answer your questions and concerns about COVID-19 and the pandemic. And the second is to enable evidence-based decision-making. Now, this doesn't mean that we have to wait for a lot of data to know what to do, but we can base our decisions based upon evidence that we have gathered already and from the past. So some what I'll be presenting is based on that. And like the judge said, we don't have to wait till we know everything about Omicron to start combating it right now. So first I'm going to start with what's happening with Delta. And as far as we know right now, all of the cases that are occurring locally are from the Delta variant. Any that are from Omicron are at such a low level that we can't detect it because so few people have their positive tests sequenced. So this is a graphic of the number of cases in the black in the coastal bend, as well as our modeled number of cases or number of infections in the coastal bend. So this is the calibration. And you saw the public health director indicate that in the past week, there was a little bit of an increase, and you can see that little bit of an increase right there, but in the last day it started to come down again, so I'm not ready to say that this is the start of something new. It just kind of looks like natural variation patterns right now, and we're still kind of trending downwards or leveling off. So based upon that model calibration, we can project how many people should be going to the hospital from COVID-19. On this graphic, the black data points are the number of people in the hospital with COVID, and the red is the projection from the model. And what you can see now is that we're projecting a continued slight decline, and there are more people that are in the hospital right now with COVID-19 than what we project. And this is common in a trough between the peaks of COVID, where maybe people are more likely to be admitted to the hospital right now if they have milder symptoms because there's not a dearth of resources available to them. So they're getting the best health care possible. And at the last count, there's 50 people in the hospitals of the Coastal Bend with COVID-19. For fatalities, we're also coming off that Delta peak, and it's projected to continue declining until at least the next wave begins. So fatalities are declining. You can see that we had our most deadly wave just this past summer. It was more deadly than the summer of 2020 wave. And this is one of the things that has us concerned about Omicron, which is ultimately how many people are going to need to be hospitalized and how many people are going to have serious COVID disease from Omicron. So what's possible this winter? And we don't have enough information yet to make specific projections about the Omicron wave. This is a projection that was made by the University of Washington, or is made by the University of Washington, and it was being made before the Omicron variant was known about, and they have this worst case scenario that you see in this peak here, which is what if there's a new variant that's 2 times as transmissible and everybody stops wearing their masks? This is what we could expect in the state of Texas in terms of the next wave. Right now, the projection is the kind of flat line, and then if everybody masked, or 95% of people were wearing masks in public situations, then we would see a continued decline to almost no cases of COVID in the state of Texas. So let's talk a little bit about Omicron. I know I talked about this last week, but not everybody tunes in every week, right? Sometimes some people see it one week, sometimes people see it another week. So why is everybody so excited about Omicron? It's because of how many mutations it has. You can see that on the right, the Omicron variant looks very different than the Delta variant. And that's because it's been made to look different, highlighting all the mutations. Now, if you can see in full color, then it's very easy to see the difference between those two variants. But for our immune systems, especially if you haven't been vaccinated, it can be very difficult for the immune system to see the Omicron variant as something that's similar to the Delta variant. And this is one of the reasons why people are concerned that there's going to be potentially less immune response to the Omicron variant than the Delta variant. And there's already preliminary scientific reports that indicate this, that natural immunity does not confer as much protection against Omicron as a vaccinated and boosted immunity would. So there's 60 mutations in total, 32 on the spike protein, which is what you're seeing here. And just in case you're wondering on how to pronounce it, it's Omicron. In the United States, if you go to another country, they might pronounce it another way. And the big question is, how much will immunity be decreased? It's not if, it's how much will immunity to Omicron be decreased by. Okay, so another reason why people are really concerned about Omicron is what's happening in South Africa. So this is a graphic of South Africa, the number of COVID cases per week. And you can see in the last 3 weeks, there's been a huge spike in COVID cases in South Africa. This is the most rapid they've seen COVID increase. It's the steepest wave that they've had. And this is what has everybody concerned. Now, what you should be looking for, and what I'll be looking for in the coming weeks, is for this to happen in other places. If this starts happening in other places besides South Africa, then we can start to expect it's going to happen here also. And if it continues with this same pattern, it could come on much more suddenly than the previous waves, because that's what's happening in South Africa right now. But I also want to remind you that there have been several other variants that we didn't even remember the letters for. And the only ones that we really know are Delta and maybe Alpha, and maybe you've heard Beta a little bit, but Beta never really took off in the United States. Alpha did, And then we had the original before that, and then we had Delta. And there's all these other variants that we haven't heard about because in some parts of the world they took off, but they didn't take off across the whole world, and that's why we're not as familiar with them. We're not sure yet if Omicron is going to be one of those, but all those mutations you saw on the last slide is what has us really concerned that it's probably going to be one that spreads across the whole world. So, last thing is that there have not been any reports of increased virulence, and that's a good thing about Omicron, and maybe it's the only good thing about it, but ultimately it doesn't matter if it's less or more virulent. What matters is what proportion of the people are going to contract it and what proportion of them are going to need hospitalization. Because ultimately, the whole reason for this huge public health effort and why COVID's different than the average everyday flu is that because it's novel, because there's not a lot of immunity in the community from it, it can overwhelm our hospitals. And that's what we're concerned about with this next wave is how much of a load will it put on our hospitals. We don't know the answers to that yet, but that's the reason why people should be concerned and you should take this seriously because we don't know if it could overwhelm our hospitals. What we do know is in South Africa, it's coming on very fast. Okay, so in summary, the cases, the hospitalizations, and the fatalities, they're all continuing to decline, and all of the local sequencing has been of the Delta variant. Over 99.9% of all variants in Texas are the Delta variant right now. But there are reports of Omicron in Houston, and I want you to know that scientific reports that I've seen indicate that Omicron was circulating 6 weeks before we heard about it. So there's a period of time that it takes for it to incubate in the community before it really starts getting up to detectable levels and driving a wave. So it's in Texas, but it's not moving our needle yet. Recommendations, don't panic, remain vigilant, number 1. 2, get vaccinated and boosted. Early scientific evidence indicates that people that have both full vaccination and boosters have more immunity response to Omicron than people that don't have any vaccinations or people that only have the 2 mRNA vaccinations, that's Moderna or the Pfizer, or 1 Johnson & Johnson. You're eligible to get a booster shot if you're an adult and your last Johnson & Johnson shot was 2 months ago, or your last Moderna or Pfizer shot was 6 months ago. If you're symptomatic, self-isolate. Nobody knows if they have COVID or not until they test positive, right? You might just have a cough. Not everybody loses their sense of taste and smell. I had COVID in August of 2020. I did not lose my sense of taste or smell. The only way that I knew that I had COVID was I tested positive and I had a cough. That was fairly mild. Different people respond differently. If you are responding, if you have symptoms like a cold or a flu or anything like that, you treat it like you have COVID and you get tested for it. While you're waiting for the test results, you self-isolate to make sure you don't spread it to anybody else. And then when you get your results, if you're positive, you immediately call your doctor or call the public health department and sign up to get the monoclonal antibodies. That's designed to help you stay out of the hospital. And if you're negative or if you haven't had any symptoms, make sure you mask up in public. This will prevent you from getting COVID in the first place. Social distance, do all the things here, wash up. If you want to avoid getting COVID, avoiding crowds is a good way to avoid getting COVID. And we'll be here next week, I believe, to give you another update on the Omicron situation and what's happening locally. We'll see if this little blip that happened over the past week is just a blip or if it's the start of something more. So we're going to go to a translation, and then the public health director will come and answer any questions that there might be from the media. Thank you.
Los casos por COVID continúan aminorando lentamente, así como los casos de pacientes hospitalizados, aunque aún no se cuenta con suficiente información para realizar proyecciones por la variante Omicron. El número de decesos también ha disminuido. ¿Qué se espera este invierno en Texas? Las proyecciones indican que los casos pueden aumentar al doble si las personas no utilizan cubrebocas como medida preventiva. Lo que se sabe de la variante Omicron es que cuenta con 60 mutaciones, aunque este número de mutaciones no quiere decir que esta variante es más peligrosa. Los casos por esta variante van en aumento en Sudáfrica. Tampoco hay reportes de que aumente la virulencia. En resumen, los casos por COVID, hospitalizaciones y decesos van disminuyendo. Omicron se encuentra en Texas. Se recomienda no caer en pánico, pero tomar todas sus precauciones. Tome la vacuna y los refuerzos. Si cuenta con síntomas, aíslese, hágase la prueba y si resulta positivo, lleve a cabo el tratamiento de anticuerpos monoclonales. Utilice el cubrebocas en público y continúe practicando el distanciamiento social.
Thank you. Are there any questions? Seeing none, thank you for joining us, and we'll be back next week for the COVID-19 update. Thank you.